Mrs. Fiorina, I'll direct the first question to you. It was submitted by Katka. Have you developed a campaign platform to comprehensively address the prescription drug abuse and heroin abuse problem? If not, do you plan to develop one? And if you could elaborate.
I think there are three aspects to what we can do from a federal level to help this problem. Number one, as I spoke about, we need to provide sufficient resources to the community-based programs that work, and we're not. So there's, the federal government is awash in money, and so much of that money is wasted. We need to make sure that community-based programs that work and innovative solutions that work are provided with the resources they need. Second, criminal justice reform is key because, as I said, we are not treating addicts by throwing them in jail. Third, we actually have to prosecute those doctors that overprescribe, and we know there are lots of them. I spent, I don't know, it was maybe 6 or 8 weeks ago, I spent an hour and a half with 15 veterans. And I listened to these veterans tell their story. And I listened to too many of them tell me that we have doctors that literally are turning people into addicts because they're not taking the time to understand and really treat someone's trauma. They're just prescribing a pill. I know this is what happened in our daughter's case. Third, or fourth, we need to re-examine the HIPAA laws, in my opinion. Because the HIPAA laws, the privacy laws that were written originally with good intentions behind them, HIPAA laws have served as a way of isolating someone from anyone who cares about them. I can remember desperately, as a parent, trying to figure out all the doctors that Lori was going to. And it's pretty easy. As you all know, addicts are pretty smart. And they learn how to game the system really well, particularly if their addiction is to prescription drugs. And so they shop for doctors. And they go to doctor after doctor after doctor until they find one who will give them what they want. And I remember desperately trying to chase through Lori's doctors. And because of HIPAA laws, it's virtually impossible. If you have an addict who is an adult, it's virtually impossible to intervene if they don't want you to know what they're doing. It's virtually impossible for a community to intervene. It's virtually impossible for a place of worship that may care deeply about this individual to intervene. And I remember as well, finally finding a doctor that would actually take my phone call. And I will never forget what this doctor said to me. They said, "I cannot talk to you, but I can listen. So tell me what I need to know." So we really have to relook at so much. How we fund treatment, how we treat addicts who have broken the law as a result of their addiction, but we also have to relook at some of these laws that were intended to protect people, but that serve instead to isolate them from people they love and allow them to game a system in a way that's deeply harmful.
Thank you. Next question, maybe Annette Escalante, Vice President at Keystone Hall. Maybe you can start with this, followed by Sandy Coyle, Director of Recovery Services at FedCap. What has worked to date in prevention, law enforcement, and recovery? What has worked?
Is this on? Okay. I would probably say that one of the things that works is when you have a community that works together, when you have different agencies that come together to work for one common goal. I will tell you from the treatment perspective that we have now in Nashua, we're starting to work very closely with the Nashua Police Department because we have to. Where it was before, and I liked what you had mentioned, the whole confidentiality in HIPAA where, it's not necessarily us and them, but it's us working together in order to be able to provide effective treatment for the folks that we work with and for folks in the community. So I know we don't have a lot of time, so I'm going to pass it over to you.
Thank you. I would echo the value of community collaboration. That is just so key in the work that we've been able to be successful with here in New Hampshire. And not just community collaboration, but collaboration across the system. So when we say prevention, treatment, and recovery, not thinking of it as these separate systems of care, but really falling into the continuum of care and looking at whole health needs for the people that are seeking support. That also puts at its foundation advocacy with healthy policy, and creating healthy environments that are conducive to prevention and access to treatment and access to peer recovery. So I think those are the things that have worked well. Another thing that has worked well over years, it takes time, is to really work towards a bottom-up approach. Our communities and the leaders within them are the true experts. And while we need funding resources and we need some structure to fit into as kind of a coordinating hub, so it's not overwhelming on the outside of where to go and who's doing what and where do I get the help when I need it, but to have a network of providers that can come together through shared experience, shared knowledge, shared resources, and not necessarily cookie cut what's working and programs from one community to another, but to learn from each other and tailor that and with the uniqueness that our communities have.
Colonel Quinn and Eric Adams, Eric's Laconia City's Prevention Enforcement Treatment Coordinator. From the two of you, your jobs have changed quite a bit. There are new necessities, there are new protocols, and it seems to be changing every day. Talk a little bit about what needs to be done in the law enforcement community through your eyes and your experiences.
So we definitely need to take a more balanced approach. In Laconia, we started the Prevention Enforcement Treatment Program roughly a year ago. And with that, we work with the individuals and the people in our community that are suffering from substance misuse directly. So when there is an overdose in Laconia or up at the Lakes Region General Hospital, I respond to that overdose. I work directly with the person suffering as well as their families, connecting them with resources in and around the state. So that collaboration in itself is huge. Law enforcement, we've said it so many times for a long time now that you can't arrest your way out of it. Well, we've known that for a long time. The problem is we need to make sure that there are programs in our jails, in our by using drug courts. In our community, we don't call it drug court; we call it recovery court, and that's thankful to and it's that momentum that we need to continue. And I can just give you, as far as Laconia specific, for us this year, we've had 83 overdoses, which 9 of them were fatal. Some were fentanyl related. Of those excuse me, of the people that I've connected with, it's been 95. So I've made contact and spoken with 95 people in our community that are suffering. So it's not just the ones that we respond to as far as overdoses. Of those 95, 55 of those were receptive to actually speaking with me and wanting to work with me. Of those 55, 41 right now are in some form of recovery. And that is, those are people I follow up with every day, okay? Whether it be me, one of the other social workers that I work with, and that's the thing, it's the collaboration. So you need that in and around your community. And law enforcement can take the spear on that because of the fact that we are the first responders. We're the ones there, you know? So I'll let you kind of add on, Colonel.
Thank you, and I want to just applaud Eric and his chief for thinking outside the box, because if we keep doing the same thing over and over and over, I think we all know the results we get. But I would just like to say this, on the law enforcement side, some of the things that we're working on, and again, I'm not going to sit up here and talk about great arrests we've made or seizures, because in the end, we have been doing that for many, many years. But what we want to see is we want to see some output and outcomes. And the outcome, we want to see that number going down of the drug overdose deaths. So that's the goal. So I want to introduce, there's a young lady sitting in the back, Deirdre Bolter, and she's our senior intelligence analyst. And she is collating and looking at all the data so that we can make evidence-based decisions on what is working, what isn't working, where are people dying, where do we have the treatment, where are the Narcan being administered, and to look and see from the northern part of the state to look at the entire state and see just what's happening, because we all talk about what's happening here in Manchester because it gets most of the attention because there are the highest number of deaths here. So it's, as we're in a crisis, now more than ever, it's more important to stay coordinated, and law enforcement is coordinated. And I want you to know that we have strong partnerships with our federal partners. We work together with the DEA and task forces so we can identify these most egregious drug traffickers and take these cases from Manchester to source cities and to Mexico. So the partnerships are there. However, we want to make sure that as we continue to make these arrests, we address these nonviolent, people that are addicted and these major traffickers. And I think we're doing that. I think we recognize that because we want to see these arrests result in some treatment that gets people rehabilitated back to work and a productive member of society. So I think all of law enforcement, I think we're all on the same page. So to that, I think that New Hampshire is completely tired of seeing the deaths, and people do want to give information, and we want to stay coordinated. So what we're trying to do is get all this intelligence collated together, because what's happening here in New Hampshire is happening in New England. I meet with the New England colonels. We have a compact called NESPAC. What's happening here is happening in Rhode Island, in Vermont, in Maine. So it's important to get all the information and get the public to start supplying this, because these people that are diverting are either on the verge of overdosing or those that are supplying. So we need to get the information together. A couple of things we've done, some of these mobile enforcement teams, we're helping the cities and the towns, working with them because they cannot put the time into looking at the interdiction part or addressing that because they're dealing with so many calls for service and other things. But one piece of data that we haven't talked about today that I think is important, and I've been working with the Attorney General on it, is we had 18 homicides in 2015. So if we are going to eclipse 400 drug overdose deaths, how many drug overdose investigations do we have? So two things that are on my radar and what we've got in the pipeline are we've been doing search and seizure training. We're upping our game. So if we're asking law enforcement, let's get out there, disrupt, interdict, the flow of drugs. We want to make sure that we're following, both constitutions and doing it the right way. Now, on the other hand, what we're working on is a plan to how do we respond and how do we handle the overdose scenes. So can we start connecting the dots? Let's get all the data on these people, these victims that have died, and let's see who's responsible for it. Let's collect the data. Many of these people are involved in other states, so we all have our fusion centers. We're looking at our software now to make sure that we've got a good portal to get it in and share the information. So in a crisis, it's most important to stay coordinated, stay focused, share information, make evidence-based decisions. So those are two things that I think are very important as we move forward. And again, I'll end with this. Law enforcement, I will tell you this. When these people are getting arrested, these people that have problems, have addictions, at the lowest level, there are no high fives going on out there. There is no victory in that. Everybody wants to see these folks get help. And so I think every arrest is an opportunity to save a life. Every arrest, if it's handled the right way. And I think we have to just be smarter as we move forward and have the infrastructure that can get that. And I'm happy to work with you all and stay committed to it. Thank you.
Mrs. Fiorina, this is submitted by the National Council for Behavioral Health. We know that addressing the opioid crisis will require approaches that address prevention, treatment, and recovery supports. What specific policies or approaches do you support to address all three of these needs?
So thank you, because I was about to interject. You know, everything that we've just heard up here and from these wonderful experts tells us a couple fundamentals that work. Number one, community-based programs. Why is that important? It's important because the closer people are to the communities and the individuals affected, the more they care. It's sort of basic. So we have to acknowledge that somebody thousands of miles away doesn't know and doesn't care in the same way as people right in the community. And that's why I think it's so critically important that we empower community-based programs, community-based law enforcement, so that they have the resources they need to collaborate in an effective way because they care. Secondly, of course, there are things that are federal in nature. Criminal justice reform is a federal responsibility, and so it's a critically important part of finally helping to solve this problem. But there's also another federal government responsibility, and that is to secure the border. We talk a lot about securing the border with relationship to immigration. And in fact, I said in my remarks that the federal government and our political process, our political class, has failed us in many real ways. Well, one of the real ways that the political class and the federal government has failed us is we have been talking about border security for 25 years. But now it's not just about immigration. And it's not just about terrorists using a porous border to threaten the nation. It's about drugs. It's about drugs coming over our borders, whether it's our northern border into the state of New Hampshire, or it's our southern border into New Hampshire and lots of places in between. And so my point is this: the things that only the federal government can do, criminal justice reform, securing the border, those are things that the federal government needs to do and needs to do competently and well. And the government hasn't. It's why I'm running for president. And the things that a community does best, coordinating, collaborating, caring about the people in their communities. These are things that we need to empower and resource communities to do.
Dean Lemire is Regional Substance Misuse Prevention Coordinator, and Tim Rourke is Chairman of the Governor's Commission on Alcohol and Drug Abuse Prevention, Treatment, and Recovery. Gentlemen, what type of addiction resources and strategic programs are needed to prevent this challenge from getting even worse? We're trying to get control of it now, but it's also getting worse. Go ahead, Tim.
I'll start, Dean. Thank you. And so a couple of responses. I'll speak to what's happening on the state level and then maybe just talk nationally about some of those national solutions. I have the great pleasure of sitting at the nexus of the public and the private response to this, which is to say that while I serve as chair of the Governor's Commission in our state, which oversees disbursement of a pot of funding called our Alcohol Fund to support prevention, treatment, and recovery support services, I also work for the New Hampshire Charitable Foundation, which is the state's community foundation, and we as a state are quite blessed that in the late 90s, a generous donor gave the foundation his estate, which is valued at approximately $50 million to reduce the burden caused to the citizens of New Hampshire by alcohol and other drugs. And I'm thrilled to look at the audience in here and see so many of our partners and friends and grantees of both of those bodies who do this work every single day. This is not just a public health issue. It's a public safety issue, it's a national defense issue, and it's an economic issue. The state of New Hampshire in 2013 lost $1.8 billion, almost 3% roughly of its gross state product due to untreated addiction. And by the way, $1 million of that was alcohol. So the opiate problem is not our problem. An opiate response is not an appropriate response. We have to finally respond to a disease, substance blind, that kills millions of people. A disease that is entirely treatable and in many cases completely preventable. So I think there is part of the response that is needed is money. This is about money. The state of New Hampshire ranks near the bottom for per capita expenditures on addiction services of any kind, prevention, treatment, or recovery supports. The only other state in the United States where you are less likely to get treatment if you need it is Texas. So some of this is about financing. In our state, we're working, and there's efforts ongoing with the legislature as a result of the opiate special session that took place over the fall. We will see in the spring legislative session a conversation about increasing funding through the Alcohol Abuse Prevention and Treatment Fund, which has never been funded at its 5% allocation since the year it was passed, in a state that makes $650 million on the sale of a drug that kills more people than all illicit drugs combined. So much of this is about money, and at the state and at the federal level, Carly's spoken to it, a number of other candidates and elected officials have spoken to it. These are tough times to be talking about new resources, but there is a need, as Carly said, that we have to have that conversation. But I think there is another. As we talk about the continuum of care, you have to do it all at once. As much as we can't arrest our way out of this, we can't prevent our way out of it, and we can't treat our way out of it. We got to be doing prevention, treatment, and recovery supports comprehensively at the same time so that everybody gets exactly what they need when they get it without question. And in order to do that, there's one other thing that while it does have a financial implication, it's really, really basic. People's insurance cards need to work. I shared, I met Jessica earlier, and we bonded over the fact that we've been in this field since we were 15, involved in youth prevention and substance abuse programs. But I also come to this work with a story similar to Governor Christie's, and then I have a son who's a pediatric cancer survivor. When he was diagnosed, he had a massive seizure at the age of 15 months. Within half an hour, we were in an emergency room. Within 20 minutes, he had a CAT scan. Within an hour, we had a diagnosis. And before my wife and I even had a chance to respond to the trauma of that news, he was in an ambulance on the way to a specialty clinic. He had his tumor removed in 2 days, and 2 weeks after that, he started treatment. And over the course of the next 2 years, he received chemotherapy that would kill an elephant. My insurance card worked. But if my son was not a 15-year-old pediatric cancer survivor, but was a 13-year-old struggling with alcohol abuse, or a 25-year-old hooked on OxyContin, his insurance card may not have worked. And I may have had to have mortgaged my home, taken a second or third job, made sacrifices to my financial health and the financial health of my family, all because my son was unlucky enough to get the wrong disease. In this country, that's discriminatory, that's wrong, and we can do plenty. And thank you. And there are all of these incredibly important policy measures that need to be done. Criminal justice reform, increasing prevention programming in schools and in communities, because schools aren't the only places it needs to happen, increasing public awareness and reducing stigma. But if people who have a disorder cannot get in a chair or a bed across from a specialist, a peer coach, a clinician, an addiction medicine specialist who can help them, and their insurance card does not work, nothing else we do matters.
Dean, I'm going to have you jump in. God love you.
How's that, Dean?
Go ahead.
Well, I wrote 4 pages somewhere, and I don't have a chance to read it all, so I'm just mentally drooling and just listening to Tim. I'm just like, yes. Yeah, I mean, a lot of this conversation is for naught because people still, especially in our state, cannot access treatment when they need it, when they ask for it. My experience was, I'm a person in long-term recovery from alcohol and heroin and all kinds of other substances addiction. And for me, that means that I haven't had a need to use a mind-altering substance since June 6, 2012. I'm able to be a father. I never had a model for fatherhood growing up. I can do that somehow. I'm a husband. Never had a model for that. I am that. And I'm a source of support for hundreds of people suffering from substance use disorders and their families. All in 3.5 years, after I was finally admitted into a treatment center. So my experience with that was, and I say this because it has not changed. It's gotten a lot worse. I was calling an in-state, a state-funded inpatient treatment center. I did not have any insurance. I spent all of my money on, who guessed it, heroin, That was my life. That was the only thing getting me through every hour of my day. Yet I managed to work a job, and by all accounts, I looked very much the way I look now. Maybe a little greasier, but nobody could believe that I was addicted to heroin. And when I told, arresting officers, like, look at my arm, I need help, they didn't know what to do. And we spend so much money and energy into policing a class of drugs, and yet I couldn't find treatment. And that's kind of, Officer Adams is my hero. I love this new approach. When I'm approached, there's commercials in this state, I think they just ended, of me saying, anyone, anytime can recover. And I wish that were totally true in New Hampshire, but it's not. So people see that, they see me as a source of support, maybe they can get treatment. The best option that I have for that person seeking treatment in my region of Stratford County, New Hampshire, is to send them to a detox in Lawrence, Massachusetts, the hub of heroin dissemination, or a police station in Scarborough, Maine, where they don't even have Medicaid access. That's ironic to me, and that's the best that we can do. So 3.5 years ago, I was arrested. I had been, I was blacked out. I was on my way to go get heroin. I had been calling a state-funded treatment center for 3 weeks, and I lost hope. And I went on this last bender, and woke up in a police barracks, and just swore, like, I've been calling 3 times a day for 3 weeks, every single day. I lost my bed because I missed my call, because this is where I am right now. That's criminal to me. I was one of the lucky ones, and I act like it. But so many of my peers and so many of the people that I went to high school with, in wealthy Exeter, New Hampshire, are dying from this disease. Unnecessarily so. They are forced to, we all grew up drinking. We were told not to drink. We were told not to use drugs. So once we did, we had to do that underground. And we couldn't talk honestly about it. And as problems got worse, we sought treatment, and it wasn't available. I snuck through, and now I'm really mentally drooling. But I sit next to community leaders. I'm a public health coordinator, and we're trying to find community-based solutions to this epidemic. And we spend our nights finding the funding for these solutions that we come up with. Christy talked about recovery coaches. That's totally our bread and butter. That's the drum we're banging lately. Peers in recovery who can offer free services to somebody who needs them, whatever that looks like. Our state, we're totally ignoring alcoholism in this talk. That's where my heroin addiction started, was alcoholism. It progressed. Alcohol did not fix what was going on inside me at a certain point, and I moved on from that. Our state controls the sale of alcohol. It's the 6th biggest income source for our state. No wonder why they do not want to give any of the money that they had promised to prevention, treatment, and recovery efforts. It was in this year, while we had the most deaths by overdose in this state, our legislature legally changed the percentage from 5% for that alcohol fund of profits to 1.7%. How can you justify that? And that's the only money for this, for prevention, treatment, intervention, and recovery efforts. So I sit next to community leaders, and in the same breath that they say, we're doing everything we can, parents, we're doing everything we can, they also say, well, we're going to invest more into law enforcement. And there's just such irony in this. I don't understand it. There's no data to support that traditional police intervention helps somebody to not be addicted to a drug.
Dean, I think most of the people that are in the room today also have questions. They've seen a family member suffer, or they're learning about it and helping those that need help so much. We are opening this up to audience questions. If you do have a question, if you wouldn't mind standing, we do have a person over here with a microphone, and they will come to you so that you can address a member of the panel. Does anyone have a question? Go right ahead. I bet we can hear you.
All right, I don't think I need a microphone. Everybody's talking about finances and how much all this stuff costs. What can we do to get the profitability out of the drug dealers' hands? And why are we going after the addicts instead of going after the drug dealers? The addicts are the ones that need to be in clinic to be helped. The drug dealers are the ones that need to go to prison. And in my personal opinion, we should execute them. Because when they come back out of prison, they go right back to what they were doing. Too much money on their end for them to give it up.
Eric, do you want to touch on that?
You said something. So there are two types of dealers, and this is one thing that law enforcement is finally, I will say, starting to realize. Okay, you have the dealer who is profiting, and then you have the dealer who is supplementing their habit. Okay, so identifying which is which, they are doing that. Okay, they're working on that. That is done every day. Okay, there are a lot of police departments in this state that when you do arrest someone with a possession, okay, they're looking into, okay, is this really a dealer, or are they just possessing it for their own addiction? Okay, so that's when, like in Laconia, that's where we make that separation, and that's where I come into play, or our narcotics detectives come into play, and that's being done on the state level. The colonel touched on it. I agree with you that the dealers need to go to jail. I get that. Okay, so the state is working on taking that balanced approach. Unfortunately, it's taken a long time for it to come to that. But there are a lot of police departments in our state that are recognizing that and that are doing that. So I don't know if that...
No, well, that only answers how.
Okay.
How do we take profitability? Should we, like some of the other countries in the world, have legalized drugs on the federal level? Take care of the people now that are addicts with federal money, federal drugs, and put the drug dealers out of business. Because if they can't sell their stuff for profit, they won't do it anymore.
Yep. There's exactly. And the other approach to that is you take away that need. And that's where the recovery community comes into play. The more people that are working towards helping each other and stay in their recovery, who's going to buy the drugs? So
There's no
there's different
math,
ways to
right?
approach it. You know, is there any one right answer? I don't think there is. I mean, there's so many different facets of approach that can be done. I mean, I'll let the colonel talk about the federal aspect of it.
And I agree, but sir, just to address the one point you made about why we're targeting the users and the addicts, I will tell you we are not. A lot of times the users, the addicts, non-violent offenders, they get themselves arrested. They're the ones that present themselves, whether it's a shoplifting arrest or a crime or a larceny, or their addiction will eventually, if not treated, will escalate to the point where, if you look at all of our bank robberies today, after these folks are apprehended for bank robbery, and they're introduced, they're drug addicted. They're fueling a drug addiction. So, as I said earlier, every arrest is an opportunity for recovery and treatment if it's handled the right way. Now, I will say this, that I think we all agree in this room that those that are selling and trafficking fentanyl, and again, it's a deadly, deadly drug, or heroin, and they're not using it, they're profiting from the misery and suffering and death of others, should be addressed. And I will tell you, oftentimes, and we've got operations going in the state, you've heard Granite Hammer. Granite Hammer is a multidisciplinary approach. We have approximately 50 officers working at one time, DEA, state police, local police, drug task force. They have a plan, they have a mission, they have a very detailed approach, and they are arresting people at a lower level and breaking those cases up immediately and getting people that are transporting up 200 grams of heroin, 10 fingers, transporting up 250 grams of heroin. And then when we take it to the crime lab, we took, Senator Shaheen, we touched briefly on the backlog at the crime lab. I've done a tour. It isn't until the drugs, that brown powder in the bag, makes it to the crime lab that our forensic chemists can actually say, that's fentanyl, not heroin. I mean, it is lethal. So I guess the approach is not to go out and target people or target those that are just, that can't help themselves. We do make those arrests. But once those arrests are made, it's an opportunity to get them out, as Eric said, if it's handled the right way, and we do want that to happen. We don't want to see them go through the door again, but there has to be an infrastructure, there has to be a plan, and there have to be people there, recovery coaches, detoxes and centers for immediate treatment and then aftercare. But I will tell you that the New Hampshire, the law enforcement approach is not something that we're going out arbitrarily just looking for acts. But again, as I said, that arrest, oftentimes, I think we all know that people aren't just raising their hand saying, hey, come take me to detox. Sometimes an arrest, if handled like an Eric Adams, talk to them. What do you need? And then we have the plan B so we can get them there.
Colonel, we're going to, Mrs. Fiorina, did you want to speak?
I just wanted to add one thing. Alcohol is a legal substance. Alcohol is a profitable industry. Alcohol is extremely addictive in the hands of an addict. And so legalizing a drug actually doesn't prevent addiction.
We're going to go to the next question. Go ahead.
Heather Levitt, and I was recently released from the state women's prison in Goffstown, New Hampshire. And I would ask why this panel of representatives does not have anyone from the Department of Corrections, where people are sent for addiction-related crimes. The ability for mothers, for women to get treatment there is very limited. I had to search for it, and today I'm substance-free and 18 months sober. I survived through that prison system and searched for every available resource to me and took advantage of what was there. There were many women who did not even realize that they were valuable enough to search for resources. They did not think they were worth it. And as I sat there every week of the past 10 months, someone either overdosed or died days after they left that facility. Those were my peers, those were my classmates, people who took relapse prevention with me, people who slept in a bunk next to me for a year. I had to make a decision not to go to our halfway house to try and become a member of the community there, because you can use drugs 5, 6 times and not be sent back to the prison because they don't have the space for you. And it's going to take, somebody is relapsed in that house, it's going to take someone to die before that changes. So I asked why all of the resources that I was able to make in prison, I'm no longer allowed to tap into. My late act is not allowed to respond to my emails because I was a prisoner. She helped me survive for a year and a half. That doesn't make sense. The volunteers that took their time to come in and help treat me and hear my story, I cannot reach out to.
Why don't you let Tim answer the question?
Congratulations on your recovery. It is very good to see you. So the Department of Corrections sits on the Governor's Commission, and I will tell you, and I'm so glad you're speaking to it, because there is this challenge where we have in our state, if you're lucky enough, if folks are quote unquote behind the walls, very, very limited access to support, which seems counterintuitive because, pardon the pun, but you're a captive audience. And so in terms of for folks struggling to find recovery in the community, for whom transportation, childcare, some of these other barriers are there, when folks are in that situation where they're behind the walls, they're in an environment where they have access, they have the ability to access the support services that's made available. There are 2 challenges we are facing as a state right now, and this is certainly live in our conversation with the legislature on funding priorities. The first is the extent to which we can make sure that there are resources available behind the walls while people are in, and that we make sure that there is a seamless and completely supported way to integrate people back into the community in a way that is patient-centered, that works for them, that works for the community. Because what frustrates me to no end as well is that there are a number of county jails. Sullivan County's become a national model for their reentry program, where the moment someone walks into that building, the goal is to get them out clean, sober, and healthy. And the entire tenure of someone's stay in that facility is really about that reentry work, that recovery work to get them back into the community. We don't have that similar model in a lot of the state systems that we have in New Hampshire. Additionally, a lot of our state system is also challenged with the fact that even if they do provide something behind the walls, quote unquote, the capacity isn't there to transition people out into the community with something that is the right level of care that they need and deserve. So we're lucky to have the recovery centers beginning to open, that are beginning to welcome in and orient people who are leaving the justice system around how to integrate back into the community and live in recovery. But right now, Department of Corrections in our state is sitting on, for lack of a better term, a Vivitrol project. Medication-assisted therapy is one mode of treatment. It works for some people. The department would like to make that available to folks with opiate disorders who are behind the walls, because Vivitrol is long-lasting and it would give them time to get out into the community and find the resources, but they can't start it because they can't find prescribers in the community.
Hey, Tim, I'm going to interrupt you. Mrs. Fiorina has a really tight schedule. We have time for one more question. Go ahead.
Yes. Hi, I'm Melissa Silvey. I'm Director of Public Health for Stratford County, and I'm going to direct this at Mrs. Fiorina. The cameras are here today. The candidates are here today. The primary's coming. What happens after you leave for our state?
It's a great question. And one of the reasons that I think 80% of the American people believe we have a professional political class of both parties that cares more about its own power, privilege, and position than on getting anything done is because politicians have a penchant for saying whatever is necessary to get elected, and then they go off and do as they please. I think ours was intended to be a citizen government, and I think we have to return to that. So what I've done as a candidate, not a politician, is I stood up and said, hold me accountable for what I've said I'm going to get done. Why do you know that you can hold me accountable? Because I come from a world where you come from, and you know that talk is cheap and actions speak louder than words. I started out as a secretary. Eventually I became the chief executive of what we turned into the largest technology company in the world. And let me tell you the level of accountability that I'm used to. Every 90 days, I had to stand up and tell everyone in public exactly what we've done, and then project forward what we would do in excruciating detail. And I had to answer every single question in public. And if I misrepresented our accomplishments or our projections, I would be held criminally liable. Imagine if we held politicians to this standard. I am prepared to be held accountable by the people of the Granite State for every single thing I say. And I will look forward to coming back in 2018 and asking you, how am I doing?
Mrs. Fiorina, thank you for your time today.